system. And no malaria a draw tatashe. You see, very tough on malaria. Malaria chill now for vegatum, but him. A bay races here. Sounds like the Asadaka Sia Pa, Yam Vita cereals, no, or more maize, or more wheat, or more rice. And Qualadian and then some penny phones to tidy because Nemupeso or Bano, any check, no young dear, no sober pet Yam Vita man, or more can one, or more sachet. They are holding better to be able to me Akotobi. Sounds like the Asadaka Sia Pa, Emma Endpoints Homeopathic Clinic. Endpoints, they are real the bomb with Chambia, a Yareni endpoints, no. The Omun to mean Saho Yarena Nekaka, like a senior area of then so apart from a scenario, Yarabia at Beko endpoints are Sabia, endpoints Bessia normal, endpoints were Summer Community 22. Sounds now called Princess Road, Shell Signboard, endpoints 4 Uko Kumasi Kronum Abunia, endpoints 4 Uko Anaji Estates, our Sakradia, endpoints 4 hour Uko and Zuma, endpoints 4 hours. Sounds now called Western region, endpoints 4 hour. Sounds now that's so Emma Kantanka Immaculate Herbal Booster. Supplements back up. Upesa body extra SCP, Esita, and Ransom here Kantanka Immaculate Herbal Supplements. Now they are sorts out. They teach near specialized mineral water, almost soya say, and they did be the bremo. Or so water is life. Now Benum and one with specialized mineral water. Brother, sister, you see dear, now one monsieur cry, then 4 to 5 sachets of water. You see no super dear, crudgy and muda hopa dear, and the special ice mineral water. My uncle carton for a bar for a bar, ye rahefra officer. They di opemunanga sako bonkomo, they be silent a hefrano. Or mujube dear pot say, listen, so move close to close and crop offices and I, and one on one, and now on mujume diano, dempa and a jumedian assetche, yan rahon combrases here.
Yo, my cat they use Kojak quality oral care product. Today, Kojak charcoal toothpaste. None of most my Fanano, ma'am. What up now, saying?
Hey, Mrs. Aquano. Oh, no. I kick say. Edia Bain, I kick it would say. Now won't take Kojak PNF toothpaste. Any of my mouthwash no. Ye free hanum say ya kona kopebito esan sen ho nya nakra ebo mo se typing film mo se de ye wona me nua be
ane emfa won si endia grokra every say ebetumi aha wodachi ni senti ne de Kojak oral care abedwaso ne demonstration Kojak charcoal toothpaste ema won si ye fita na emma na hoden Kojak regular fluoride toothpaste epu ehuro ema won si ye din na emma wenum so ye sham na ekotia kaka se we obi so a unseta femfem abra wodi bibia enyu anase ehia wodi ani Kojak P any Kojak F toothpaste ene ne mouthwash no tusumreka na kwaje wodi Every Kojak niema die, eye quality keke. Upe biato a ubenya bi wo Ranko Pharmacy eye Kojak for retail pharmacy ewo East Legon American House. UBA Bank nonchen hwa. FDA aji edwadie nkratu yi atum.
When malaria strikes your home, it strikes everything. Sleep, peace, and even work. Don't miss deadlines because of malaria. Don't lose your sleep to malaria. No more endless worry because of malaria.
Olenoko, enough!
Fight malaria back with Vegatem. Vegatem is effective, safe, and fast-acting against malaria. With its alu-alu packaging, Vegatem tablets stays effective right to the very last tablets. Vegatem is also available in suspension for children. Vegatem, tough on malaria, easy on you. If symptoms persist after 3 days, please consult a doctor. This advert is FDA approved.
To me, Chenya Oba, any betchemu, and na dear bedachi. Nanso, ubit me up one manenia pomodin free ni mo France. Yam vita ye de milk pap pebi. Ni nutrivi aye ye nkwada etiania. Eye de na amodia e woman no bua mo fra pomodin. Anyo, impeni for swimming chopa. Yam vita gumo do Yavita, a delicious way to grow. FDA, Aji, a JD, Pratoyatum.
Said the master my train and may try hosma aquaba. Na ye call no make catch him say ne ye babe bonko more afa hefra. Na say some mood train de pa. Baby obe fabia hefra na mo to obi clinic mo and hefra is say na hefra is. Inzi ye titu no mo ya ba. Ye ni opem mu na nkasa e babe bonko mo. Dr. Winfred Ba. She or ye CEO health facilities regulatory agency ono ye CEO ene ne ba be bonko dog ye bo akwaba
ye nia
to si twine ne ye be buga
na de be buga
enya zam kitsa na bibia boko de ejuma mu ti sen
oh bibia ye fine
o ba ye nsi ye tse wonka
reset agenda na
okay part of the research agenda
part of the research agenda presidency of pese obia obeko hospital no ono abehu se bibia mi kon onbetimi ahwe mi yie obi nye bibia ebe prami ana bibi wo ho pese ye facilities ni na omo ye need no mo very good care to all of us.
Okay. Ninya research agenda na hefra trendy sir. Nti dog ye me pacho obi a o hwe ye ne ebia wate hefra no na mum onim ejuma kopotse have facilities regulatory agencies ne ye mo ejuma potse anything
yo mdasi nti health facilities regulatory agency na hefra no hefra no ye agency a ewo Ministry of Health. Yes, I see. I just say, ye minister ni honorable Kabinamita Akando. Aha. Na yen ye ni say, baby ye shit ni power. Aya resabia ana baby ye any healthcare wo. They say hospital, clinics, lab, pharmacy, over the counter, maternity homes, dental clinics, ear clinics. Even telemedicine, medical aesthetics. Ninya eka ye jumano. Inti nya bani si ye ni say ye make sure say before obi be operate as a health facility no. E say ye ma license.
Okay.
Na sana ye be ma license no. E say ye make sure say say banu nipa umbe ye jumano. Ye be make sure say wo nipa dodo a eso mo ye adwuma no eso because say regulation bi eni obi bet me akọ bie clinic na bia onu nko a
okay
say incrofo ba on ti me sure mo nti e be make sure say at least eso wo depending on your facility eso wo doctors eso wo nurses eso wo lab omo ye lab technicians or lab technologists eso wo omo ye scan e bia sonographer and accountants ni other administrative staff. Inti emrano ashishe say there were different levels of facilities. Ubanu ti say be a hospital. They started from maybe chief's compound to health center. Then there were clinic, polyclinic. Then we have primary hospital, secondary hospital, tertiary hospital, and quaternary. At each level, no, emrano emanya prescribing nipa dodo a eso wo ansana ye betimi ama wo license
okay
but what you say this unni sa nipa dodo na ye ma because ye hwe say e bia say wo se wo ye tertiary hospital na wo doctors be 5 pair but ye there ye juma nti ansana be you have to show to us say wo nipa dodoa.
It depending on nipa facility no one. And quantity of people healthcare personnel are obey here. Much checking in
na enya quantity nipa. Quality ni so count. Interest in making sure say nipa no mo ye they are qualified and that they are registered with their councils. This is a doctor, so you registered with the medical and dental council.
What's the difference between the HEFRA and then the medical and dental council and the nursing and midwifery council? I thought they were also agencies or bodies regulating them. What's the difference?
But your difference in this, those councils, no, say medical and dental council, allied health professional council, they regulate the personnel, the practitioners, the individuals. If you're a doctor, you need your license from medical and dental council. We are nurse, you need your license. They only regulate the individual.
The individual as a person.
As a person. But we regulate the facility, the whole facility. Including the people working it.
Building in microphone
and now what goes on there, we regulate that one. What you say? Before you be making sure say we cancel no a license you, and now we are in good standing. And apart from the quantity, no quality, no so account. Apart from personnel, and doctors, pharmacy, bet me money pharmacy na and a lab, no so who qualified people, you check in.
And it's also a lab, or so lab technicians now, or they should be qualified lab technicians.
Yes.
What pharmacists, pharmacy shop and so on. The pharmacist should also be a qualified pharmacist.
Pharmacy council, a
man license.
But what you say?
Okay.
Yes. And apart from it, also, you share infrastructure, no building, na kasa, because you person. Nanya is to protect the public.
Okay.
Say patients no move back home. Make sure say who nantina hospital be and lab there. You don't go back hurt or harmed. Until you make sure say even the floor, the things we do they are very detailed. Even the floor, if it's slippery.
The form hono.
A form hono. Say you slippery.
The hospital form.
Patient away weak that or be now or be pra. Until you make sure say even the floor no is it appropriate. Building no is it disability friendly. Say obi disabled or bet me in wheelchair abana. Ninya you check it. Check it say is it safe? Live wire it say wires na PAP. Obi timi touch e be shock no. You check it ninya say bibia you fine. Say roof no is it leaking? Is the structure okay? You check it ninya. And now, is that an emergency exit? Said the bus is here. And for 9 crop befa. The one with Jumana, before I ever my license, not just say I check it when in. Apart from no, as a woofer, you better check it, say, your place is it fire safe? They say, have you put in measures I better prevent it a jar? And I say, a jar to more. There were fire extinguisher or a better media. Because patient why you're weak. Baby say, on to me, Johnny. Into what have we put? It is before no. About making sure so we fire service certificate. There's a call fire service. We be check you no more install it bibia mount. No more certificate. Into your bar.
I know so much check it.
You better check here no. And that you will be a EPA environmental protection. And almost as a more certificate say. We place and a company bibia no. You are not posing any danger to the environment. Then after no, you better check waste disposal. So when him say hospital there were different kinds of waste. There were infectious waste. Apart from general waste, you know. We say a child nipa blood, nipa placenta. Now say way ebia obi fat now they are to ebia river. For go back to science, you know, they can get infected. Until you have to tell us how you dispose of the waste. You have to give us a waste disposal plan. Yes.
Wow.
It is not a Juma Kitwa. Before I can say your license, all this is to protect the public, the patient from harm.
Now, health facility regulatory agency, you know, about and I'm saying never. Because as I'm saying, I hear to say, oh, where any license, you're close, where you're close. Now, it's one hour, and half an hour.
Never heard that.
And see what was going on then.
Well, so almost year almost
Okay.
but this year so yaba. So me can tell this is a new administration, new government.
Now more reset.
Yeah, reset it. Presidency or per se, obia obeko hospital. You sure say be safe, obe receive quality care.
Na maybe so makoji fire extinguisher or fire service so mama like ma satisfy me mama me afi be am building correct roofing obi na ye ma me bibi aboko. Why do I need the HEFRA to come and just reassess it all over again?
Okay.
And son of mama me license.
It is something like fire, no? Your banner my fire certificate now. You will just see where the extinguisher is, and no one will do anything.
You just want to confirm
say it has been done. Once they are professionals, at least we just want to see say fire extinguisher no. Apart from no, we also look at the equipment, sir. With the age, man.
Equipment.
So we see. We are hospital. If you be back no here oxygen, oxygen manana. Because so we be would say we hospital. Now obi back no here oxygen now man obe. Until you be making sure say we oxygen. Now be change tanks and na say wall and now source oxygen supply. It must be adequate. Asana you be take care no. That's what I say. So also what theater? If I say you machines are using.
Oh, theater.
Machines no. Near Juma now obi there.
I say
now there. The your engineers on be check is when ya. Making sure say fine. Emergency a drawer. If an emergency drugs. Just say owo aka obi. Si na idina ba wo no. Oh, in draw the be manana. It is checking all those drugs.
Which is very comprehensive.
It takes weeks. It takes weeks. The some because we say my apply and my license number. We take our time and no. Fine because say I check it nyama we nya uba hospital la. E bia o hia emergency drug bi na o mo say ni ho. By the time I be call next one e bia na we wo. Na human life dey back up. Wa woni say this is a untimi man anything that ye juma no very important. Someone why na anye ni year ye na e bet me affect obi and I make say when it comes to health care no and health no so who sikati say Bill Gates na be adenesi wo baby at least oho no mo do be ko first and so na be ka say mo fa plane ba na helicopter na mo be fa me na say baby a ye do be ko no oho omo ni nyama na obe wu ansa na helicopter o ana wo private jet ni beba enti ahu nya se mo nyama be boaye na HEFRA no enti mi ye adwuma no fine ti e check all those emergency drugs personnel and the processes enti the person who governance structure na who is the nurse manager is he qualified doctor, medical superintendent, lab manager.
That is a more share so obi ankofo obi akeke.
Dabi
Emba hospital ho.
Dabi.
That is a more share map modern they are qualified and registered
to do their work. Inti by the time you can say hospital we are licensing we are sure say you are safe. Because act say we should make sure that facilities provide safe and quality care.
Safe and quality care.
Yes. Because what we Uba hospital now obi a quack. No more wrong injection. And no. Patro what you say.
Matthias. Okay. And see, yeah, funny say obi 8 you and nipa no epese or no we still need dying or so the bear hospital. Or medical and dental council for a doctor. Nurses for a big go. What's the registration process? How does the person go through the registration process? Now, answer na yebeke no. My entry hosima and combra. And we went out some of the videos from some of the clinics that was shut down. Madam Pierre na no den HIV. Inti actually man for yeba. We will come and look at Obia was set up or per se or bed licensing, the process the person has to go through. You try and come back.
When malaria strikes your home, it strikes everything. Sleep, peace, and even work. Don't miss deadlines because of malaria. Don't lose your sleep to malaria. No more endless worry because of malaria.
Ole loco in nine.
Fight malaria back with Vegetem. Vegetem is effective, safe, and fast-acting against malaria. With its alu-alu packaging, Vegetem tablets stays effective right to the very last tablets. Vegetem is also available in suspension for children. Vegetem, tough on malaria, easy on you. If symptoms persist after 3 days, please consult a doctor. This advert is FDA approved.
Want to mean Chenyaoba in the Pechemo and not your bed action. Now so. Ubit me up one manenya pomodin free ni mo France. Vita ye the milk pap pebi. Ni nutrivi aye. Ye nkwada ediania. Eye de na amodia e woman no bua mo fra pomodin. Hanyo impeni for sweeting chopa. Vita gumo do bebre. Vita a delicious way to grow. FDA adi e dwedie yin krato ya tum.
It's in my so demi.
Wait a camera. I'm so giddy man with you. Pro code.
Oh, and then an answer, and I'm called drugstore, Ecoto Pro code. Now, so still now, me trade us up pie me. Pro code and cry any.
Mamma, hey, Debbie, a fake. Best in your drugstore. Me patch your top pro code. Debbie, anyway.
Oh, gee, now we see you do pepper say pro code now, and it won't so at the phone.
I am a man for better on paper coda. We fake at the mawam. Enter Sansua, when you for frotter woman say, a year Juma the Sassan ye procode ye Jumana. Nansu Debbie, a dread to be Boama on Hotel on Tamdi, and one procoda, Kojak a 4 naye. Send your Kojak procoda, and ya dare Betty.
Enti we no original pro code no. Ya twere Kojak go so, and an chance with dear Suboso, Kojak no.
Say it, Paye, Pepu, University, and Nasa or one dodo. A dread to me a woman water on Tamdi, and one procoda, Kojak of 4 naye.
Procode, K-O-J-A-C-H. Procode.
Sankrat way, FD Ajatu say a ye.
Doctor, feeling my body. Tell a friend to tell a friend. Give me the body and come up and a trapper. My health, all my life, oh. Been quiet in my pomade. My health, all my life, oh. My pomade in my health, all my life. Been quiet in my pomade. My health, all my life. My pomade in my doctor, feeling my body. Tell a friend to tell a friend. Give me the body and come up and trap up, baby. A rubber miss story. Since me won't come. Do you wanna learn more? And I get ready. Cause it's all about you. My health, all my life, oh. Been quiet in my pomade. My health, all my life, oh. My pomade in my health, all my life. Been quiet in my pomade. My health, all my life. My pomade in my it's all about you, family. On your TV. In Kwan in my property. My health, all my life, oh. In Kwan in my property. My health, all my life, oh. My property in my Kwan, eh.
don't want to say my train and my try Kai say we are on DSTV channel 360, all our social media network, so very, very active. And Dr. Winfred Ban and Bonkomo, CEO, and my Hefra. I go for no more trending and say, a job could be a no more trending, no more close in for shop, or more close in for hospitals. Mom, and we are. So I share and say, you're looking at the quality and also it's part of the research agenda. I'm making sure say, Obia Benya Apomodin Papa, a bebo nipano. Dog, you try on Nami Bisa say, what are the processes? Obia is in a dime. On one or a doctor, and a ward and for nurses for, and also a person be a clinic and a way be. So be uncle for about show more rights. Why all licenses be more licensing process no? What's the process?
Yo, me dasi. Licensing no, here. Send a can a boy in your home by. Obia betting I a patient at any time. It's like so right now. So uko fly maybe I go to buy. Na aircraft no. O maka cho say we there. Ya nye checks wo ho befo. Umfo. But hospital they licensing na obeko. Because you are afraid that something can happen. And that's what regulation and licensing does. Because you want to check all the dots, all the I's, all the T's. You want to check everything. Because sometimes something small. And no. But what you say. It is important. And that's why the Constitution of Ghana found it necessary. Say we need to regulate the space. Any space regulating, chaos will happen. There's chaos.
There's constitution binding it.
This one is set up by the constitution, though. Yes. Yes. So we can prosecute, can take you to court.
Sir?
You can be jailed. It's in the act.
Who need license, sir?
Hey.
And I go for
Oh, with the train. Anyway, who can say Ebia Obi was seen need that Ebia and then also any nana Ebe license Ebia walk see who bedroom house bina you want to convert it. You say we get some changes. Because hospital no only say yeah for example who theater. It should be situated that baby in Kofo entimi 19 because of infection. Enti enye dan bia na obet me der hospital.
Okay.
Na say who own house can person the hospital and they just we hear some adjustment. But ideally no person see hospital they have architects who know how to design hospitals.
Hey, and you want to mean sorry and sit down in some hospital?
They say, wow. No. Now see with me the hospital. If you are single room. If you are 6 on the road, then say me the when you passed away.
Okay.
And the hospital ideally must have a good architect to design it. Because you are emergency, who are lying in ward. Or theater. You cannot just place them anywhere.
Okay.
It is not just business as usual. But yes, say you have your setup facility, and no person will register. First, yes, we say call your website.
Okay. More websites.
Your website. www.hefra.gov.ga.
Okay.
The uko your online. You have an online mobile online MOIS application portal. Ehu here class obebaha. Oh, okay. Online.
Mine digital.
Patrol. To ko honuma requirements nya media kan nya certificate na and your certificate of your staff and business registration so ehu here because it is a business.
Okay.
There's a registrar general certificate.
Okay.
Even your bankers have to write to us say you have enough funds to run the place.
Okay.
It's one of the you need to give us a bank. Yes.
Hey.
So we hospital maybe hospital
it's a business.
Do niska we be running because for be ba na say me niska me be to draw and am be tia staff car e be ka the make sure say at least you have funds to run it is sad documents ni nya we be upload omo e wo your portal no so then you make payment ye wo fees are charge for inspection depending on your level no. And we just have payment now. Your officers no more on be check registration on be check.
Okay, obi to computer no one be
registration office.
Okay.
And obi it is a documents ni na fine na on be fair.
So you don't even have to come here. Everything is
computerized. Anybody money
to register.
Don't let anybody take money apart from the statutory fees.
No? Okay.
It is a bibia you find your best friend. Then we'll schedule an inspection. After registration, no? Now you call inspection. Inspection is a your barber say who send you
the same.
The same.
Oh, okay. Okay.
And now also oxygen, a percent yes. Also nebulizer, a percent yes. Also theater, a percent yes.
Okay.
The yebeba for inspection. It especially your team. You was specialist at omoye no. You train you. It is a hospital, at least a doctor back count, pharmacist back count, lab person back count, nurse back count, and an administrator.
Okay.
Into mobile almost bibia, and as for my friend assessors, we've trained them very well. We conduct training for them every year on what to look out for. But what you say? Into omuye no na omuye fine omu the report beba. The omu the report in the bar, then your board no your work. What we call license review committee. This our committee no omu the report beba. It enya omu a be share omu no be endorse we. There were other people omu see special. Omu be share okay. Say no muka. Em say omu see omu wo we. Say na share are they qualified na omu qualified. Then we approve. You approve here, then we give you the license.
Yeah, che.
It depends. But me buy no. Then who say she say no there were two different kinds of licenses.
Oh, okay.
There was a provisional license.
Okay.
In Abia, who apply and I feel now who share clinic and a lab and a scan center and say. Into your bahonuma. Abia only say who shall say there you may not have everything complete, but at least the minimum standards no it should be there. They will write recommendation. Into no you be more provisional.
Oh, okay.
License. Now say net here.
Okay.
Provisional
license.
Okay. Into no. Naturally say who we were honoma is for 6 months.
Oh, okay.
Until within 6 months, maybe I can say maybe emergency exit no identity by that time no now why you till bar then you be more we na friend long term license.
No, okay.
But on long term. And no you red provisional no you blue.
Oh, okay.
Until obia
I'm function amount for clinic. I mean so share.
They must display it.
Okay. Okay. Also with the boho.
Yes.
And so to wear provisional just for 6 months.
Yes.
And I wear long.
It is a BBI fine. I wear a lot. I wear for 3 years.
Okay.
The amount wear just 3 years. As an person.
And see inspection. Ukraine dia muye every month.
No.
Ghana for. And Zedin uncle for. I thought say it's like monthly. 3 years.
The amount wear.
3 years. As an about review, I check him. I cautious the BBI okay.
And now your salary we license.
And Uncle Fonya.
Yes. Until after your mom we no. And no just say your mom we are just a jausa.
And no.
Your friend monitoring. After license no. Then we move to the next stage. Your friend monitoring. Sometimes you call inspection obi be call borrow obi scan machine. Maybe also
no they are besio.
To show we are na oda. Inti ye na friend monitoring.
I know they wo
na ya ba ye catch us say ye ba. Oh.
I no do go to.
And na dey go to.
Your friend get this clinic now.
They me body. Inti ya no dia ye nka kire say ba wo ho ana ya ba say inti bibia ya okay we wo ho
na mo check
that is when we check inti we keep on ana e bia say patient be go hospital na we hu say bibi nko ye sometimes mutimi ka kire we will come there and sometimes we even do undercover just to verify for ourselves e betimi asumo bi na on ba ho as patient. Just so that we'll get hard evidence. Then now we'll take you on. Maybe we'll take you to court if we see you are doing dubious things. Nyama yesa uye wo that's the monitoring. Apart from we no, e wo ade ye friend no accreditation. And no, a different level. Getting a license is meeting the basic minimum. Accreditation is the other level where we look at quality. Ebia, wo say wo dental clinic. Obi so wo dental clinic. Ebia, see office we a friend is saying braces. Now we can now grade you according to quality. We ultimately fire now 1 star, 2 star, 3 star. You can say this one is a 3-star hospital or dental clinic. This is first. That part of our work, I think I yet develop here.
Oh, okay.
Until we are starting what we call from next year, accreditation. I don't know. It is
so
not
it's different from the license.
License now, that's the basic minimum to practice.
Okay.
But if you want to be accredited, if you a fertility service, then you're 3-star.
With your chest.
And no, you have to apply. And then we can accredit you. The next year, that is the new thing now, accreditation. And then most of the companies and things, they choose you based on your accreditation.
Yeah.
It's not going to be business as usual. With you encourage people to improve and have quality.
To join the best.
Yes. They know they're compulsory.
Okay. Now, doggy, anano na moko na mo close nkofo clinics no ne shops no. Na obi bisa say, inti na patients na omugu ho no. Ana one factor omo into it ana.
Oh, but ye factor omo into it. Inti ye core. Most of them no ya more letter dada. You can't just say so what patients refer omo to the nearest clinic.
Oh, no more catch omo dada. Then say mo bore mu akeke.
Dabi.
But even mo say mo an catch omo.
Inti ye ba ho na patients wo ho. Ebe ma o for example, ye no recent tamale. Almost a letter need delay.
Yeah.
Because now there were a lot of patients on the ward. There are more time, some few days. Say refer all the patients or more hospital for free. Until you be refer munya ansana too.
But in a situation, say nipa provide quality care, but just say only license ne. Have you ever encountered that?
How do you know? Until you go through the checks, you won't know.
You just want to verify.
Aeroplane, very nice. Na regulator catch us away, no? Ya checks will going to be full, Anna. It's nice, oh.
It's nice.
Yeah, check is a pilot, or you're qualified. And you are now a Dimi PR, say, oh, my pilot is away. Overflow. Excuse me, I can't be full. That is the essence of licensing. At least, who dear, a FA crab, my say, boats ninya tight. Windows ninya closify. And then we can get on board.
Okay.
But what you say?
My fan is but along the line, what are some of the challenges I'm facing? Do you have enough personnel? Because looking at the job you are doing, it entails a lot. It entails a lot. Now more personnel, more
Yo, one of our challenges, personnel. But you rely on what we call external assessors. They are training, maybe doctors, lab, pharmacists, are more. They are not part of us, but you are training them as maybe a consultant or as external assessors. It may be any time, maybe you call baby na here in Crawford.
Double up.
Then they come and help. But so far, no, we are supposed to be in every region, and with time, try getting to districts. But you see, out of the 16 regions, now you 9. We have offices in only 9 regions.
Wow.
I say other regions, no. Some of them double. For example, Volta office, it takes care of Uti region.
Okay.
We call Bono. It takes care of Bono East, ni Ahafo. Then the Northern takes care of the Northern region. Apart from that, all the others we have offices. Since I are taking over this year, no, Nyamiado, the 2 regions account. We are opening office in 2 regions. Upper West, ni Upper East. Because Ohono is soon. And the staff we had in our office in the North was just like 5.
It is because
of that, no, they are not able to reach omutimi ko. So a lot of fake people and quacks are practicing or being. And so obisa said now you
no, yeah, and I get it. Matthias self video.
Pasisia no yes, we will not allow our numbers to restrict us.
Number movie.
Yeah, movie. Na ye woni nya ye ko na ya ko. But because of some movement, so we have vehicles.
Vehicles and financial support. How do you do all that?
Yes. Vehicles, no, out of the 9 regions, no, only 4 have a pickup. The other need vehicle.
Then how do you
that is the thing. So you have to rent. Then they give us up. Pharmacy, some of the other agencies, no, and also you have to pay people this. They has been challenging. And since I came, I said that one will not stop us. So I write to the ministry to Ghana. I say, oh, move my vehicles. They give us when we finish, then we bring it back to them. But very soon we will be 9 hours more. So with the work I am now, we are generating some money. They will start also buying now. You're turning but so be one person buying so. Any big pa.
Now me work clinic. And I'm a hospital, I'm a wow. No one's ever close to me.
No, your companies for her. Individuals, so more mutia. Obia betting I a patient. It is a wood here. Patch or carbi and a baby or person de boyan. Fabra. You better acknowledge you. Now say healthcare is better. It's better. You have contributed to it.
And it's a multi-sectorial way.
Yes.
You need the facilities, you need the money to run it. But more yard, more yard, pa. My mind the mood. I don't know. Let me share. Me share with you. Hey, it's one and that form style and that form. But more yard, more yard. Now, yen show. Obi road be our license. Ebia. One renewable after 3 years, no, one be renew. And no sir, no yan independent.
Okay, and that's it is license no expire. It is the Emrano say it is illegal to practice without a license. And now say who practice with an expired license. The Emrano as she say license expire now who practice here, it becomes illegal. And you know what? It opens you up to legal issues. For example, say Ebia Obi Bawo Hospital. Na Ebia why operation man na bibia ko wrong. It is possible because anything that you feel consent for. It is possible so better na court you will go free. But said during that time no your license has expired no. And no judge they will not even go into the merit. Then means you are practicing illegally. Into lawyers no ombe di kapa bet you what to but who license if you bet me I defend yourself we say and this I did what I'm supposed to do just unfortunate I am they may have mercy on you. Okay, it is having the license so a protective one court now expire we into your home sir we can either give you a fine because an administrative fine. You better need to withdraw. We can also withdraw your license. Then we can also close you down depending on how serious the thing is. And then we can also take you to court for practicing without. In fact, that one, anybody we can take you, but usually you don't always settle. Because ADR it is about boko. You know akasa. Uti afi na why you so you na. You be jano. But say unya. Then you do back court.
Yeah, some more. Yeah, banana no be the question be too many me ba. Me more na me bisa. Also I try I don't see on meeting standard. And what does that mean?
In fact,
what does that mean?
Or person or be hospital. And also need doctors. Usu person hospital, usu person primary hospital, and now we bed 5. We can downgrade you.
And also can meet standard.
Yes. It depends on nipa no apply for. Say who need personnel no be adwuma no. nyama na odi be adwuma no ye ntimi ma o cause ye ma wa wo be ha nkrofo pacho what you say
for that's why I share my health, my life, my pomodin, and me kwa Ewa United Television. So, I said we are on DSTV channel 360 and all our social media networks are very, very active. Me are joining in on social media network and also. But a question be our person ubisa dokana ode fani nyina bra. E babu boni nyina e de bebrano. Na question no wa answer ni nyina amao. Yene Dr. Winfred Ban and Bonkomo. He's a CEO for Hefra. Ina yene Bonkomo. Send answer what to say Hefra for. Omaji news na afa. Omutututu for a clinic mo. Na ye sheda. Question back one person sir. Do you extend more wings not to the traditional hospital herbal medicine for no?
Dabi herbal for no under traditional medicine practitioners. They are just opposite us. You are another counselor or regulate.
And they are no herbal for regulate.
Regulate herbal for.
Wow.
But
because herbal for be a clinic.
Very good. Say uye herbal. Now uye other things apart from your herbal way no, you are contravening the law and we will come after you. Uye herbal now uye scan. Now it is illegal. Upesa uye scan obeji license every year. Enu ye mwa. Enu bedi pa. Very soon. And you need transformation. We'll be going together.
Okay.
Yes, and work together.
I'm not checking because I know some people are more running as a clinic.
Pamujai. Because I can't cry a bebaho. Who yes can Hefta and Beji.
A body compliance. So how is EFRA ensuring my license and microphone? They are ensuring the compliance of the rules and regulations. Na bibi ekosi.
That's it. The enona ye friend monitoring no. Inti we send sometimes no you send the microphone. Sometimes they will even come as patients just to go through the system who say bibi aye fine. And also you encourage patients. So uko hospital now who bibi na who say yeah. Pacho send you a message.
Is there any contact?
Yes.
Or is there any number?
Pacho your
patients no bet me are reach more.
Your contact your WhatsApp crowd bet me send you pictures ni videos. Bet me I can't tell say tamale dia no. Starting with patient and water or send you a video.
Okay.
And I send you no and I just send you profile to go and investigate. To muko as patients. And I yenya hard evidence and I approach you. It is sometimes no patients and I be a we work our hokra now who say nyama ko ya mpacho free Hefra and I send the videos pictures ye be ko ye mbo wudin obi ehu say eyewo na waka che it mpacho numbers
and so would ye she would say ewa obi ehu say ewa na so de onim say eyewo pa
it mpacho numbers no me di be ma
okay
na udi atudwa na obi a opeso my information bia no of ambre.
Okay. And see me who says the number now to hono 025 61 08 267. And see na have for a year kokonsa line no. Opeso di kokonsa chomwa. 025 61 08 267 at that screen is so but you person otrono obet me actual
no but we have WhatsApp line
WhatsApp line videos video oh okay yeah. And we have for consa line
yeah consa line
it was a very that's why I share my health my life our United Television so I say any Dr. Winfred Ban CEO of EFRA and a bonkomo, ye bonkomo afa efra ho, de koso ewo maso ye ho, niamo moye, de awoso a uwo eyi health facility awoso se wo ye a wo so de be bogana fo ho ban. Se ho ban bo na ye show. Se wo siesie ho e de abo patients no ho ban na wo so de abo ho ban because doc kasa yo so konya e court amanihu na wo kasa so I've registered with HEFRA my license no krania nanso e mistake na ba ya it be consider na e hwe na woni license dia ana license e wudi and there was some no kra bobo kra and yentimi ndi but doc hospitals na dos clinics na dosun aesthetics no adosun scans omo mojuchecha scans adosun say bibi adosun as a business e bi wo horror okra na wo yema say aha na ye we wo so how are you going to regulate all this body me I'm sure within Accra be 10,000. How are you going to regulate all and monitor all these facilities?
You that's it. Anything we can say we are doing our best.
You are doing your best.
We are still asking the ministry so my more staff. And my minister is working very hard on it. So Obama and more staff. So we are getting more staff, more logistics. By Jumani dear. Once Mudi and Sheha de take here. Sometimes you feel office in them. And as we are talking, my people are in Ashanti region. Wow. Chiefs compound, so in Chiefs compound. That's the lowest level of care. All this while they have never been registered.
Almost count.
But Sisiano is excellence at Daromati. You be starting free primary health care. Okay. Until we want to make sure say a quality. Okay. Say because you say free ninety. Ubeka say uko ho na more paracetamol no. A person quality. To start quality starts with regulation. This is here it's excellence. You say me cough no more fields is here. Yeah. And there are plenty. We are using external people or mobile. But we are thinking outside the box. You see, you need enough staff, but that what we have.
You use it. In your time of duty, this year now but have you experienced any difficulty with a client, a customer, a clinic, or maybe I'll close it down? Nippon say, who close and close? Have you experienced any difficulty while you are there?
One of the good things they say, just start here Juma way more. In fact, most of the people say, "Oh, my idea, it's in Nanamu way and because in fact, so what would him say? You environmental political. Just start here, Bimu. If you say, hey, if I for bet to me, no, my friend, and now minister, and now not your friend. The omu friend me too me book.
Also, the old me, I'm Brazil.
Me too me book. Now my church room. Say honorable say ni say you share. We mu. Sometimes if I show you some of the pictures, no, I can say, hey, no, you have to do it. It well, you need penny back home frame me. I was playing your show. We obviously you're close now. We share. Hi, Anna. Me so honorable. We share. We. Me kasa we by time you not see. Hey, no. Go and do it. You see, we have reinforcement. Craft frame me. Remember reinforcement because Obia who say, yeah, no. It is for all of us. So many can anybody, even President Kratimiya. Now, who was he can say emergency? Nearest place I'm going to do better. Anamibwa. Yeah. It is I am making sure say oh you find that your life you can lose your precious life. Exactly. Pachomatias here. That's it. I am confused about which church you want. It is so far no. We have not had even KMA clinic. If you make your friend, Monsieur, just do what you have to do. Then we fast track it for you. Then we open it for you. But so far, no, we've not encountered any difficulty.
Maybe a cause of
maybe a cause. The minister now can say, "Wakache me say, me call baby na obi provision me be friend. Ono ani e beko."
So far, me want some more close now. More prosecute obi. Ana endu ho ye.
Oh, yeah, the Biako court.
The Biako court.
Say who person yes stop.
Yes.
Ana who ye quack there.
Fake for the yank of crowd.
Yes.
What the baby?
Yes.
Dog, and come on here, but when you say was so sorry, it's major. Then once and I'll be then I'll be fit so bang and I'll the beggar Magana for Omutio. First to the general public, secondly to the facilities, and then third to the facility heads.
Okay.
In Timpacho by a foot sugar.
You me that see. In the general public, no thing na ye wo. Ye juma mamu. Ye pese ye bo mu ho ban. So that muko facility bia. Obia nye bibia be ham mo. Ana o ebema wa lose wo life ana wo body part ana bibi. Inti ye juma mamu. Inti ye pa wo musu mu boye. Mu ma ye information. Mu support ye. Mu encourage ye. Na ye juma mamu. Na facilities no clinics labs pharmacies ye madam for ye nyina ye juma ma the good of Ghana intimi pamocho let's work together the person collaborate and then do it mpacho say and say na can your number no 025 6108 267 025 6108 267 Pacho uwo ana wo facility po na ohia mwa e bia wo registration documents wo upload enko pacho free ye be boa wo free of charge obi an charge wo hwi ye wo ho and a facility heads pacho don't sit down for your license say be expire e bia 3 months before tell your administrator men transima your license 3 months before start the process no then we will all be happy the damos and the media people no so mu ya de pa edamwasi se mu support ye na mu boye nyame nhira
bibia ebusiafo e de na de besi ha yedamu nyina se mo hwe nyina yedamu ase compliance no na ye ka no hefra omuso bia if you have a facility you have a facility you are the head whatever you are me patcho ye so bia nya compliance na maternity wards no I may catch on more hefra for the motion no hospitals clinics laboratory pharmacy diagnostic center for no omo say we do on start share nem omo ka ho bi maternity homes chiefs compound matisa ni nyina e ba be ka we mpamcho wonim say was facilities bi eye care dental care ni nyina aesthetics omo anansen omo body shape microphone no me patcho you are all supposed to register and get your license from HEFRAC. Say me be fi me ni kra wo ba me show no so kra be bisa so wo HEFRA certificate na we ni bia me njo because ni nyina aka ho na nyina ye make sure say obia edge apomodin papa ye da mu nyina say wonim say register ya kona register the number is now to screen no so obetumi akọ mo site no so www.hefra.gov.gh me patcho a simple process o ko wa no register ehun ya so beba ha krapo so register wo computer no so phone crowd so to me ball phone so now share registration now enter they will so enter they will get back to you so me pabocho maba mo se me mbram be kama mo me dem me buy is we ye close dem mo kai me enti maba me the dog abebo nkomo wa cheche ase me gidi se muso mati ase so let's follow the due process and then mati say our constitution we are aban kababecho echo nso Abigail mean to me bejo mean to me fair dog nka je se me pacho me mpacho me minister class tum na me ba be pacho ma me ka hwe ma nti pacho do the proper thing yenya papa and now we are so kwa menim so yare mo hwe look out for almost certificates no the various clinics and hospital hwe no bia amfa your life I am to chacha. Just look out for the registration certificate or the license and make sure that baby will be no would japomodin papa wa e de na de ni besi ha me da mu nyina ase dog me da ase me da wotim no so ase omo mo bua nyina PR papa ye da ase ye da mu nyina ase nsi ye be ma ye ho so na mama doctor akotbo ejuma na mom kai say you do your good and then almost be your diama they are there around going around closing someone move and so just do the proper thing go get your license and save lives. I mean, so what to bed fair, what machines fair, but you need a license to make sure say you are doing the proper thing. Say, within the Abigail Ashley, me crew, me the buyer say, and Rasta in need them, me danase. Sounds na me that's the answer, ma Miss Gladys Boachi. Miss don't worry, so you don't worry. Miss Gladys Boachi. I don't want na come team na call no and say make on air. Let's Gladys do the proper thing. Thank you very much. My name is Abigail Ashley. See you same time next week.
Yeah. Me no doctor feeling my back. Tell a friend to tell a friend. Get me the body and come up and a trap. My health, all my life, oh. Me quite my pomade, my health, all my life, oh. My pomade, me my health, all my life. Me quite my pomade, my health, all my life. My pomade, me no doctor feeling my back. Tell a friend to tell a friend, get me the body and come up and trap up, baby. Hey, Rob, I'm so sorry. Since me won't tell me, do you wanna learn more? And I get ready, cause it's all about you. My health, all my life, oh. Me quite my pomade, my health, all my life, oh. My pomade, my health, all my life. Me quite my pomade, my health, all my life. My pomo didn't mean it's all about you, family. On your TV.